But we go back to one of our top stories now, where Linda Mnisi, our reporter who is currently in Midrand, standing by with Health MEC Dr. Bandile Masuku. Now, Linda, of course, this is good news towards the preparations where the Gauteng Health Department is concerned, to ensure that it does prepare itself for this wave that is coming around July and August.
Indeed, Bongyo, and they've just signed a memorandum of understanding for that particular donation that we've seen today in preparation for the peak that the Premier says is here. But joining me right now, I've got the MEC for Health in the province, Dr. Bandile Masuku. MEC, thank you so much for your time. I mean, the preparation is ongoing, and you say you don't want to speak about the peak when you, in fact, are not prepared. Tell us about this contribution and what it will do for the hospitals in Gauteng.
It's a good contribution, and we welcome it from the peoples of Germany, and it's going to help us in the work that is already underway in building and constructing some beds in the north of Gauteng, particularly in George Mokare, Jubilee, and some of the hospital in Odi.
And another thing, MEC, is the issue around these isolation or rather quarantine sites in the province. Tell us how they're doing at this point. We know that just last week, Newzroom had about 99 people that have been admitted since the 15th of June.
Yes, the numbers are are increasing quite fast. And I think one thing that is impressive with the numbers is that it's people who are voluntarily coming up to say they need places of isolation and quarantine. And it's something that is firstly encouraging. But secondly, the numbers are coming up because for the past 4 months, it's only time that we are starting to approach almost 50% bed occupancy in all our facilities. But it's something that is working, and we're still looking to open more of the facilities which have been underutilized.
You were quite worried about health workers testing positive. I mean, looking at how things are right now, do you think you'll start calling in people that have retired to come and assist the health system with, boosting the number of health workers in these facilities?
We've got a two-pronged strategy that we have been talking about, that we are going to fill in the posts in making sure that they post in people who are in facilities, and also making sure that we've got a reserve team that will come in and fill in when there's a need, both in field hospitals and in our hospitals. So we are looking at using every personnel that is available in the country, including those who are in the South African National Defence Force.
Okay, but would you then say that the province is ready?
Like I've answered to you this before, that it's like writing an exam. It's only after the fact that you can say that you are ready. But the issue is that we have to put in a lot of effort to make sure that we are preparing and making preparations ready. And I think after the fact, all of us can sit down and look back and say, yes, we were ready.
All right, there you have it, Bongi. Gauteng Health MEC there, Dr. Bandile Masuku, saying at this point they can't really say whether the province is prepared, but can only say after they've weathered the storm that the province was indeed ready and they've gone through the test. Right now, all the efforts are in preparing for this peak. You might have seen the statement from the Department of Health nationally saying that in the coming days, Gauteng will be experiencing a large number of infections. So these kind of donations come in really handy in making sure that the province is prepared. He speaks about the issue of healthcare workers, saying that, well, they've got a strategy to work around that, as a number of health workers are testing positive. So at this point, it seems the province is, currently preparing and making sure that all hands are on deck, and that if there becomes a shortage, then they will indeed have a way to deal with it.
Well, Linda, it does look like the headache will not only be to stop the infections of healthcare workers, but also looking around the transport industry. Of course, there we saw taxis now filling, at 100% capacity. That could also be another one of the headaches there for the health department, particularly here in Gauteng. That's Linda Mnisi there watching developments for us in Midrand.